curious if there is a larger plan, if there is if we wanted to make an expansion of our health department like we did with our jail, that would that then, or we're talking about now possibly doing some things on the 3rd and 4th floor of the E. Newton Smith Center, but if they're already encumbered, may it not be a problem?
I don't think that there'll be a collateral issue that would prevent us from doing anything at our county facilities from this financing.
Will this affect bond counsel at all on some other existing properties, the bonds that we have?
No, sir.
Thank you.
Any other questions for Vicki? If not, do I hear a motion?
Second.
Okay, it's been moved and seconded. I'll skip right over Dr. Council. She had her hand up. But, is there any discussion on the motion? All in favor?
Unanimous. This is both motions.
I'm sorry. Is there another motion?
Public hearing. That's
Okay, Dr. Council.
Now, I just wanted to make sure that that included both of the recommendations.
Did your motion include both of them, Larry?
Yes, sir.
Okay.
Yes, okay. Thank you.
Thank you.
Thank you.
Item 5, Ms. Cannon.
Yes. Item number 5 is an update on mosquito control and the Zika virus by Mr. Buck Wilson, who's our Public Health Director, and Daniel Ortiz, who is our Environmental Health Director. Good morning.
Good morning.
Good morning.
Again, I'm Buck Wilson with the Public Health Department, and I have with me Daniel Ortiz, who's the Environmental Health Director for Public Health. Commissioners and management thought it would be a good idea to have an update on Zika virus and what we're doing in Cumberland County and what citizens can do to protect themselves from such. So we'll just go through a few slides here. I need to point it at what? So our purpose, again, is to describe the Zika virus in association with birth defects, and then review our mosquito prevention program and any reporting of the Zika virus disease in North Carolina.
Okay, good morning. First, I'd like to discuss mosquito-borne viruses with Zika. Yeah, it was first discovered in Uganda in 1947, and it really closely relates dengue, yellow fever, Japanese encephalitis, and the West Nile virus. With technology and upcoming technology, have you seen on TV? We were able to discover that the Zika virus was actually transmitted by mosquito bites. So since 2007, there's been outbreaks in Gabon, Micronesia, and French Polynesia. Since 2015, endemic transmission has been located in Central and South America. We've all seen the videos and the news, and it's very sad. But there's only been travel-associated cases in the United States. What that means is it has not been, no one has been bitten and given Zika virus here in the United States. It's only been when people go to these areas where there is Zika virus, and they contract it there and they bring it back to the United States. The vectors that are associated with this, the Aedes mosquitoes, it's the Aedes aegypti and the Aedes albopictus. And the albopictus is the one that's prevalent around North Carolina and the United States. In our area, it's the Asian tiger. It's very easily identified with the little white stripes on its legs. It's also a very aggressive daytime biter. That means it's not prevalent at night or dawn. It's out during the daytime light hours. It also transmits dengue and chikungunya virus. And the chikungunya virus was known last year and the year before. The Aedes aegypti and Aedes albopictus mosquitoes, this is just a geographical location where you can find these. Thank you. As you can see, the aegypti is primarily south of North Carolina, and the albopictus is more north and in our area. 1 in 5 people infected with Zika virus become ill. That means 4 out of the 5 don't even know they have been contracted Zika. The symptoms include mild fever, rash, and headaches. Severe disease requiring hospitalization and fatalities are rare. No specific antiviral treatment is available, but as you've seen on TV, there's possibility of some antivirus and vaccines coming across. Treatment is symptomatic. What that means is they treat the symptoms, fluids, and acetaminophen and rest. Brazil, 2015, reports microcephaly and other poor outcomes in babies of mothers who were infected by Zika virus while pregnant. Pregnant women in any trimester should consider postponing travel to the areas where Zika is present. Pregnant women who do travel to one of these areas should talk to their healthcare provider and strictly follow steps to avoid being bit by mosquitoes. Testing should be conducted in consultation with state and local public health individuals symptomatic within 2 weeks of travel. So especially if you are going out of the country into these areas, you really should consult your physician. And Mr. Wilson has some more information.
So as far as surveillance in North Carolina, there have been 11 imported cases of Zika virus in North Carolina. So as Daniel said, we don't have it in North Carolina. Folks get it, they bring it to North Carolina. Local transmission is possible. However, the experts feel like it's highly unlikely based on their experience with dengue and with chikungunya. Prevention is really the key to all of this. As we've talked about before with West Nile virus, it's really important to eliminate the breeding areas in standing water. You've heard this in the news, I'm sure. And bird baths are really toys, pans, gutters. We had a situation where someone had an old refrigerator. It was in the backyard. It was turned over. The door was off of it like it's supposed to be, and it filled up with water, and the mosquitoes were breeding in there. So anywhere there's standing water, we want to remove that. Mosquito dunks, which we have at the health department, you can get those and put them in any areas, shallow water around your house, and it helps to stop the breeding of the mosquitoes. Protective clothing, clearly, if you could wear clothes that protect the majority of your skin. Insect repellent, it's really important to get the insect repellent that has DEET in it. Gambusha fish, we have the gambusha fish in our county. We put them in ponds, and they eat the mosquitoes. And then limit outside exposure, dusk and dawn, as we've always heard. Mosquito dunks, this is a picture of it. It looks about like a donut, and you just put it in the water. It lasts about a month. You can get a free 4-month supply to last you through the rest of the spring and summer. And the health department gives them to you for free, and you can get those every day between 8 and 5, and also on Tuesdays we're open until 7, so you can come by and pick some up until 7 on Tuesday. This is a picture of the gambusha fish. Again, it's a small fish, about 7 centimeters in length, and our environmental health staff will go and move the fish and put them in different ponds so that in areas where there will be mosquitoes, and they can eat the mosquitoes. Mosquito surveillance survey, we were fortunate to be asked by the state to participate in a survey with 17 other counties and 3 other counties that have military installations. We are going to be working, obviously, with the Aedes mosquitoes, both the albopictus and the Aegypti, looking to see if there's any in this area. And we're working closely with NC State University. East Carolina University and Western Carolina are working with some of the other counties. Here's a picture of the Aedes eggs. And then these are all the counties that are participating in that survey. You can see Cumberland there. Wayne is in yellow because it's only the military base in Wayne. In Cumberland, we're fortunate enough to be able to do both the military base and surrounding areas in the county. So that's why ours isn't yellow with the military. And then, of course, Onslow's doing the county and the military base as well. And just these are resources that are also in your packet. Most of the information we get is through the CDC. We are going to put information about the Zika virus on our website with the other information that we have about other mosquito-borne diseases. If anybody has any questions.
Mr. Adams?
And I just have one question. The mosquito dunks, because they do look like donuts and you put outside, health risk to pets or to kids or who find them and think that they're edible or whatever.
Yeah, so you would they would go in, say, a pond or a small shallow area,
Mhm.
and they would be out, they wouldn't be reachable, and they would dissolve in the water.
So they don't put them in the bird baths or whatever? So if you're in a bird bath and the kid walks
You
up to
could
the
put them in
bird
the bird
bath,
bath,
or,
and it would dissolve. It
You
would
can
dissolve.
break it apart into small pieces,
Yeah.
but they're environmentally friendly. It's
Okay, that's what I need to know.
bacteria, And it's not gonna hurt fish, it's not gonna hurt birds. It was specifically designed for mosquitoes.
okay.
And actually for troughs for horses and cows, so it's completely safe for.
So my dog's okay?
Yes, sir.
Okay, that's what I need
Now, I
to
wouldn't
know.
feed it as a dog
No,
treat,
I understand.
Well,
He gets into everything. I
yeah,
just wanted to
that-
know.
that doesn't mean your dog's okay, man. Mr. Keith?
Real quick, I had asked you to come here because I had gotten some questions from some people about why won't we bring back mosquito fogging and the trucks and everything? And I remember from a previous presentation you made. Daniel, can you talk about the effectiveness of that sort of system?
Well, we stopped spraying several years ago. It's not very cost effective. It's, you only spray in the dawn and evenings. And these are actually daytime feeders, the 80s of albopictus and aegypti. They're container breeders. So the best source or best solution is the tip and toss, the mosquito donuts, because they're going to breed in anything you have in your yard that contains water for a couple of days. The actual spraying for mosquitoes, you're killing, good insects, you're killing bees, you're killing all kinds of insects that are good for the environment, not only mosquitoes. So we feel that, the tip and toss method, the prevention is the best key for this.
So the spray is not economically nor environmentally effective?
Correct, sir.
Thank you.
I'll point out that there are commercial people that come and spray your yard periodically. We have it done. And as they have pointed out in the past, when they just fog down the middle of the road, unless the mosquitoes are flying into the fog in the middle of the road, it's not doing any good anyway. But they tend to hide in bushes and things in your yard, and these guys go around and spray everything. And for 3 to 4 weeks, you don't see flies, mosquitoes, anything. You do see bees from time to time, but the flies and mosquitoes are gone. So, but it's out of your pocket. It's not out of the county's, but it is effective, in my opinion, for your individual yard. Any other questions for our officials? Thank y'all for coming.
Thank you for
Appreciate
allowing us to be here. Appreciate it.
This gets really bad, we'll have you back.
Item number 6, Mr. Chairman, is nominations to boards and committees.
Okay, first item is Board of Adjustments, Council.
All right, unless there are other nominees, I'd like to nominate Winton McHenry, George Lott, Robert Davis, Stacy Long, Gregory Parks, and Nathan Galbraith as regular and alternate members, please.
Any other nominations for Board of Adjustment? Okay, Human Relations Commission, 2 vacancies.
Yes, Mr. Chairman, Linda Amos and Thomasia Sobers for the Human Relations Commission. There are two vacancies.
Okay, further nominations for Human Relations? Okay. C is Parks and Recreation Advisory Board. Mr. Evans.
Mr. Chairman, thank you. I would like to nominate Stephen Harper and William McNeil for reappointment, and Ivor Kelly, Thomas Kane, and Douglas Ryan.
Are there further nominations for Parks and Rec?
Yes, I'd like to nominate Antonio Jurl. I think it's 6 spots. You had 4. Would you do 4?
No, sir, I did
You did 5.
5, and 3, 2 reappointments and 3 additional.
Okay, and who? and you
Antonio
nominate-
Jurl.
Gerald.
And Mr. Adams, this is the board which I serve as liaison.
Yes, sir.
Okay.
Okay, so there are 6 nominees for 5 positions.
Could I review the nominees, please? I have a total of 5.
Right, that's what.
Stephen Harper, William McNeil, K. Thomas Kane, Douglas Ryan, and Antonio
Sure.
Durrell. Were there others?
Yes, there was Ivor Kelly.
Thank you.
Yes, ma'am. Thank you.
Okay. Does somebody pick up Social Services Board? We've got 1 nominee there.
I had another nominee, sir.
Oh, you have another one for that one? Okay.
Yes, sir.
Name?
Harold Smelser.
Smelser? Okay. Okay, we have 7. Okay. Commissioner Adams, did I get you already? Okay.
You already got me.
Okay. Any other nominations for Parks and Rec Advisory Board? Okay. How about Social Services Board? We got 1 vacancy for that.
I nominate Susan Reeder.
Susan Reeder
She can be reappointed.
for reappointment. Okay. Are there further nominations for Social Services Board? Not? Okay. All the nominations will be closed. All right. This time, number 7, I'll call on Commissioner Glenn Adams.
Mr. Chairman, we have Cumberland County Community Child Protection and Fatality Prevention Team. There's 2 vacancies, and there were 2 nominees. One was the law enforcement officer position for the sheriff's office, and that's Detective Robert Jeffers, and law enforcement officer position for the Fayetteville City Police Department, and that's Detective Pedro Alirio. I would move that they be appointed to those boards.
Second.
Okay. Moved and seconded. Discussion. All in favor?
Unanimous.
Okay. And do we have a closed session?
No, sir.
Do not? Okay. Do I have a motion to adjourn?
Adjourn. Second.
Okay. Moved and seconded. All in favor?
Unanimous.
Meeting adjourned.